Good afternoon, everyone. My name is Dr. Aseel Takshe, and I serve as the Dean of Environmental and Health Sciences at CUD. Today, I join you to talk about the newly launched Master of Public Health at the Canadian University, Dubai. We're going to discuss what makes this program unique. We're going to discuss projects that are being done in this program. We're going to speak about our Canadian relations, and I'll be available to answer any questions that you might have. The newly launched program, Masters of Public Health at Canadian University Dubai, will commence spring 2025. This program is a cumulative of 42 credit hours and spans over 2 years. What would make this program interesting is that a Master of Public Health would prepare you as students and graduates of public health to try and tackle any pressing health challenges, to try and analyze any current or forthcoming complex health data, try and shape impactful public health policies, and implement real-world interventions that we currently need. Whether you're looking for a career change, whether you're trying to advance in your current role in the field of public health, or you just want to enter into the public health field, this program offers the flexibility and also offers the resources that are fit for your goals. Some of you would ask, why public health at CUD? Why not public health somewhere else, a Master's of Public Health? What makes CUD's Master of Public Health unique? There are several reasons that make this program unique. And I'll just give some examples. This program is a hands-on learning. This program goes beyond classroom. You will be engaging in real-world projects like health campaigns, policy evaluation, innovation technology in the healthcare, and also community health assessments, such as trying to assess dementia in the UAE through the usage of technology apps, through trying to develop healthcare system assessments, and trying to develop measures. Other hands-on experiences can be such as developing measures for microplastic reduction, trying to apply certain apps or develop certain apps for health. So it's a hands-on learning program. It has both a local and a global focus. This program aligns with the UAE 2030 Healthcare Vision and the GCC's healthcare vision, and at the same time, it aligns with the United Nations Sustainable Development Goals, ensuring the work you do through your MPH has both local and international relevance. Expert faculty, the faculty currently on board in the program are all public health professionals and researchers who do bring a wealth of practical experience to our classrooms. All of these faculty members are well-versed in industry, and they also bring the latest from relevant industries in the field of public health. While teaching, they also serve in positions such as consultancies for public health projects. We have members who are advisory consultants for the World Health Organization. We've got instructors who are on advisory boards for Dubai Municipality, the Center for Disease Control, the Global Health Network, and others. Canadian education. The curriculum of this program has been mapped to elite Canadian curriculums, and we're going to talk about this later on when we talk about the options of transfer to Canada. So how will we support you when you join the CUD to become a student for the Masters of Public Health? You will get a personalized career guidance. So your academic advisor will be able to help you to try and identify opportunities, whether for your practicum or whether for an official job. Prepare your interviews and also build connections in the industries. you're going to get practical experience. We spoke about that just a while ago. You'll be able to assess practicums and real-world projects through your advisors, through the faculty members. And this will help you boost your career opportunities. And above all, you will be working on your networking opportunities. You'll be joining events, workshops in order to connect with healthcare leaders, policymakers, and any other fellow students. One of the main concerns for any student is, if I undergo a certain degree, where will I work? Where will this program take me? Graduates of the Masters of Public Health go on exciting roles in public health entities, NGO consultancies, research and academic institutions. You also have the opportunity at some point maybe to join UN agencies, the governmental bodies, and many more. Whether you're more interested in developing policies or working in epidemiology or trying to promote health initiatives, or working on sustainable development goals, environmental health awareness, your opportunities are endless. One of the interesting things also in the MPH is the projects that you will be working on during your 2-year span with us at CUD. Currently, there are lots of projects that we are working on, and they align with the country's needs. These projects span from community health assessments to evaluating policy impacts. So you will be taking these projects on board to try and address the real challenges, and they are all considered as hands-on experience, which will ensure that you graduate with practical skills to try and make a difference in your career from day one. And I am not exaggerating. Some of the projects that we are currently working on for the long term, we're looking at trying to evaluate the knowledge and attitude of healthcare providers to dementia patients. We're looking at the influence of pollution on health of female workers in industrial areas. We're looking at the factors that affect the acceptance of patients when it comes to robotic surgeries. We're looking at relevance of tools and machineries in accident prevention, the effect of land use activities on health and safety of the environment, the impact of the aging populations on healthcare systems, the impact of food deserts on nutritional outcomes in urban communities. So this is a sample of some of the projects, long-term projects that we are working on that we would love you as an MPH student to take part of. So take your first step with us today. Start your journey towards becoming a leader in public health. Spring with us in public health during the spring term. We look forward to seeing you with us. And if you've got any questions, I'm more than happy to answer these questions.
Okay, thank you, Dr. Aseel. For all attendees, please, if you can send your messages, your questions down below the chat pod, that would be great. Dr. Aseel, thank you for the presentation. I wanted to ask you about the career opportunities that would be expected if the student graduates from promotion level, and which entities that they would expect to work at, and what would be, if you have that info, the expected salary, I would say, that they might be looking into.
Okay, so as a public health graduate, as a master's of public health graduate, you will be placed, or you will be looking for opportunities in municipalities, UN agencies, governmental bodies such as, if we're gonna keep it at a UAE level, such as SAHA, Dubai Health Authority, Ministry of Health. You'll be looking at opportunities in research and academic institutions as a RA, or continuing your PhD, or simply a researcher. You will be working in insurance companies, consultancy companies, the big four. We're talking about Deloitte, sorry, PwC, and lots of others. You're looking at environment agencies. I had a long list, by the way, but I'm starting to forget. I think this is age. So we said epidemiologists, you can work as epidemiologists, health education and promotion, and those can be NGOs and IGOs, non-governmental organizations and international governmental organizations. So when I say the opportunities are endless, I do mean the opportunities are endless. Yes, the program itself is a niche program, but the opportunities associated with this program are not niche, are not limited. Okay, Ahmed, the second part was if you let us know the salaries. Okay, actually, it's those who are registering in MPH would tell me, because those who register in MPH, we've got two groups. We've got the fresh graduate students who just finished their bachelor's and want to join. And we've got those who are already in the industry and want to enhance their skills and come back to do their MPH. So they would be working in pharmaceuticals, in the companies that I mentioned, in governmental entities. They would be able to tell us what is their salary without the MPH and how much would the MPH add to them. So I might be the wrong person to be asked this question. If any of the attendees knows, and I know it is kind of a bit personal, but do let us know. Roughly, give us a range. But recently, with the visions of the UAE and GCC as a whole, and worldwide, even when you look at Canada, okay, the amount of money that is being allocated for public health and healthcare, okay, is humongous, and they do want people in these fields.
Okay, thank you, Dr. Aseel. Fair. So we have a question about the dissertation projects. What kind of dissertation projects that's happening during the program? And is it related to the practicality of the course, or it's not necessary?
Okay. So, as I first mentioned, it's a 42 credit hour program, which spans 2 years. Out of these 42 credits, 6 credits go for the dissertation itself. One term before the dissertation, and it's the last term, okay? One term before, they are introduced, and I'm sure most of the graduates who have been in the field do not need an introduction. They take a course called Research Methods. In this course, we will be working on the concept of their dissertation, okay? What idea would they look at? Okay, we would be working on the literature review on the proposal, get it approved by the ethics committee, okay? Once this is done, the next term, they would move directly into their dissertation, data collection, analysis, results, reporting, all of these things. The dissertation itself can be either a project that we as advisors would suggest, and I gave at the beginning a list of projects we're currently working on the long term, and they are between health projects and environmental projects. So those would be an option for students. Or some of the students who come from the industry to do their MPH would say, we are currently, the industry is looking at XYZ. We'd like to continue in this project as a dissertation, okay? And they can continue on it. Add to it, the program itself has a practicum, a three credit practicum, about 460 hours, okay? Where students of MPH would do 460 hours of practicum in an industry of their choice. Those who are already working in the field of public health would continue their practicum in their area of work, okay? Those who are not will show or will kind of say, we are interested in these entities, okay, where we will get practicums there for them. The outcome of a practicum would be a seminar for the university, okay, and another presentation or an outcome that is requested from the entity of practicum itself. They would Maybe they would ask for a poster, they would ask for a report, and it would be co-supervised by the academic advisor and by the industrial, if I may say, industrial advisor.
Okay, thank you, Doctor. I have a student, I have Ahmed Bilal here asking about the practicum. So as per his understanding that this is the last part of the program, the student is basically placed in a public health rated institution or a training for 4 months. So his question is mainly focused that does it have to be in the UAE or could it be anywhere else?
Okay. So just for those who do not know Ahmed Bilal, it's Dr. Ahmed Bilal, okay? Thank you, Dr. Ahmed, for being part of this talk. So preference would be the UAE, because while you're doing your practicum, you're still registered in other courses, okay? If you're going to take it during the term, unless you decide to postpone your practicum maybe during summertime, okay, where no courses are running for now, okay? We might do this exception. But for us to approve an international practicum, you have to convince us, okay? Why? What added value will it bring to you as an MPH student? What added value would it bring to the program? And what added value would you bring to this international practicum? So it's a possibility, but it's not the norm.
Okay. Thank you, Dr. Aseel. What is the typical class size? How many
Ooh,
students per
not
class
more than 10.
were you expected?
Not more than 10. That
Okay,
might
okay.
be a turn off for some, but again, remember, MPH, we're not talking about a Bachelor of Science degree, okay? Those going into an MPH already know their pathways. And we said some of them are mature, some of them are fresh graduates, but they're graduates, okay? And in order to give this cohort the personalized career guidance, practical experience, the networking opportunities, the hands-on learning, okay? The class size for the master's degree is 10 students.
Okay. I think we have a space for another question. All right. What are the resources or the facilities that are available for the student that are studying the MPH?
Okay, so someone who's asking about the resources, I assume hasn't visited CUD.
Think
Now,
so.
the first thing I would invite all of you, whether you're going to register or not, come visit us at CUD, okay? Come have a look at what we have. For the MPH, we've got whatever an MPH program would need. So remember, you will need access to the library. We've got one of the biggest libraries around here. We've got labs. We've got our chemistry lab, our biology lab, our microbiology lab, our environmental lab. Ahmed, help me here. You know the resources. This is your bread and butter.
I think
We've got
it's more of the library and what kind of research support or papers that they would be
yeah.
using during the
We should,
studies. So I
I
think we
know,
have
we
the
should have
online.
had Menshi
Yeah.
on board. Menshi would tell you all the databases that we
Yes, yes.
have and the databases that we update on a yearly basis. So we've got lots of databases. I use these databases for my own research.
Okay, okay.
So libraries, research, and again, going back to why 10 students, okay, is to also ensure by the time they are eligible for their thesis or dissertation, okay, advisors are not overloaded with students, to give each student the time and the advice and feedback that they deserve. Okay, hence it is 10 per cohort. And as I said, you're gonna see the school You've got an epidemiologist, you've got a biostatistician, you've got experts in global health, you've got a biochemist, a microbiologist, environmental management, environmental economics, health education and promotion. So everyone is an expert in his or her own field. And hopefully we'll have someone who
Okay.
has health policy and governance with us soon.
Okay, Doctor, is it going to be online-based courses or full-time study?
Unfortunately, it's F to F, face to face for now, but we are trying our best to accommodate all our students to see what are the best options that is suitable for them. We for now know it is between evening classes and weekend classes. So we're trying to get a consensus from the current cohort who has registered to let us know, do they prefer evening classes or do they prefer a slot on Saturday or Sunday? So it's face to face, it's not online.
Okay,
Plus,
thank
we'd
you,
like
Dr.
to see you face to face, guys.
Yeah, I think we would encourage also the attendees to drop us a message on what timing that would they prefer.
Exactly.
And please feel free to reach out to our student enrollment advisors at any time, so we can take you through the application process and the classes that
And
will
feel
be available.
free again. I'm not jumping on Mahdi, but feel free to just drop me a line whenever you want an email, and I'll reply. Ahmed, it's worth also mentioning that we are giving application waiver. Is that right for the inaugurating cohort?
For now, it's case by case, and it depends
Yeah.
on
Okay.
the profile of the applicants, but we can take that on a case-to-case basis based on their application. So I do encourage everyone to submit their university degree and university transcript, and the enrollment advisors will take them through that if they are eligible to maintain any scholarships or study grants. I think last question.
Application.
Application, yeah,
Ahmed,
yeah.
application. Yeah.
Yes,
Okay.
understood. Yeah.
Yeah.
So I think last question here would be if there is any opportunity for the students to engage with the research projects with the faculty and get their names published in
One
journals.
of the traditions that we had held at the school for the last 5 years, actually, is, and even at an undergraduate level, okay, is to ensure that each instructor gets at least one publication with his or her students, okay? So we do that on undergraduate level. So imagine if we've got postgraduate level, this is going to be a minimum requirement. By the time you're presenting your defense, we do expect you that you were at least able to publish or at least get a paper accepted for publication with your advisor. And if any project catches your attention during your educational journey, you sit in a class of health education and promotion, and you notice that the instructor is working on a project that is very interesting for you, okay? Yes, reach out and take part. We need this. We need more people taking part in public health. You notice that I'm working on something related to environment, and okay, that might be interesting. Please come and help me, okay? The more hands, the merrier, okay? More collaboration, interdisciplinary, from different backgrounds, different mentalities. You might bring a notion that I might have missed. I might bring you a notion that you did not think of, and hence I'm trying to expand your knowledge. So yes, research is there outside the traditional just learning. Like we went to a class, it's not about learning in a class, okay? And the classes you're going to sit in are not the traditional classes. I'm not here to put a PowerPoint and go through it, okay? We are all here to actually teach you how to implement public health What does it mean? Not to learn about public health, but actually implement public health and try and make a difference. So yes, please jump on board any research opportunities that you see us working on.
Okay, thank you, Dr. Aseel. I think at the end, if you have any advice to the students who are considering studying master and hopefully later on to PhD, if that's their ambition.
I'm not going to give an academic advice, okay? I'm just going to tell you, whatever program you joined, whatever job you join, okay, join it with passion. You want to, that you love, you want, you're a part of it. I even say this to the new students, the undergraduate students, when they come. You're not just students. Once you step in CUD, once you step in the school, you're a family member now, okay? And family members take care of each other. They motivate each other. They seek each other's advice, and they make the best of their experience while they are here, okay? So be part of our family. Let us grow and let us make miracles.